Hi, Facebook people. My name is Dr. Kecia Gaither. I'm currently a maternal fetal medicine specialist working at New York City Health and Hospitals in the Bronx, New York.
All right. Dr. Gaither, we are going to get straight into it.
Okay.
Recently, there have been talk about just pregnancy and high-risk pregnancy, black women being pregnant and high-risk pregnancy, all in the news, from Serena Williams to Beyonce now coming out talking about her issues with pregnancy. Why is it so high now? It seems like there's a large number of high-risk pregnancies.
Well, it's interesting that you should ask me that question. I just did a lecture or a conference here at the NMA talking about being black and pregnant in 2018. So yeah, there are a lot of issues that are at hand. First and foremost, we always need to talk about the absence of prenatal care and how that impacts upon your health, particularly if you have an underlying condition like diabetes, hypertension, HIV. It's really important that you seek prenatal care really prior to even getting pregnant to optimize the issues that you have at hand. Secondly, there's also the issue of us as people of color, women, having certain inherent physiologic differences which make us susceptible to certain things such as hemorrhage, such as infections, such as early preterm delivery. So we have to consider that. Thirdly, there's such a thing called inherent bias, where we can go into a particular site or medical facility where we just aren't being heard. So a lot of the tests and the nuances of medical care that should be offered to us are not, because the provider has a particular inherent bias and just does not offer those services. So these are all things to consider when we're talking about the adverse perinatal effects that are impacting black women and their children.
I think Serena Williams talked about that.
She
that
did.
bias too. When
did.
she was asking for a certain thing, but then the
Exactly.
doctor wouldn't
They
give it to
ignored
her.
her.
Yes,
They ignored
it's
her.
crazy.
Very much so.
Preeclampsia is something that we get questions about all the time. Can you speak about that?
Preeclampsia is a condition specific to pregnancy, and it is a continuum. And when I say that, there is a mild form and then there's a severe form. It's characterized primarily by high blood pressure, edema, and spilling protein in the urine. And in addition, you have certain levels of blood pressure. For the mild case, your blood pressure runs generally around 140 to 90. You spill a certain amount of protein, and your face, your hands, your legs might be a little edematous. With the more severe forms, these are life-threatening. You can have neurologic implications with seizures and brain herniation. You can have lung issues where fluid gets into your lungs, your liver can rupture, your placenta can come off while the baby is still inside. That's called placental abruption. The baby can die from it. Your kidneys can fail. So it is a continuum, and with severe being the most ominous form, which can basically kill you and your child.
Wow. So those ladies who are, we get this question a lot too, who are waiting later in life to be pregnant, to start a family.
Yes.
What can they do? What should they be doing in order to prepare their body for a healthy pregnancy?
Well, one thing that I'm really big on and talking about with people is the issue of having preconceptual counseling. For instance, if you are of an older age and you have a comorbid condition, as we age, we frequently will get hypertension, diabetes, even if you're sickle cell anemia, go to your physician before you're even thinking about getting pregnant and optimize your health status such that once you do become pregnant, you're in a good place not only for you and your baby, because whatever you have that is underlying can impact on your pregnancy, particularly if you have hypertension and diabetes. One of the other things that women who are older should keep in mind as you get older, there is an increased incidence of you having a baby that has a genetic abnormality. So when your doctor offers you prenatal testing, for instance, NIPT, non-invasive prenatal testing, which can be done very early in pregnancy, you should take that.
Okay, okay. Speaking of just regular everyday foods or prenatal vitamins, what are some foods that maybe a woman who's over 30 or over 35 should be doing versus a woman who is pregnant or getting pregnant in her 20s? Is there a difference?
Well, I think from a nutritional standpoint, all women should be enhancing their omega-3 intake, and you can do that either by pills or by eating certain fish, particularly salmon, which are rich in omega-3s. And what that does, it's not only good for the mother's neurologic health, but it's also good for the developing fetus's health as well. So I would definitely advise an increased consumption of omega-3s. The other thing that I think is good is folic acid, okay? You can get that through your green vegetables, collards, kale, those type of things, which are high in folic acid as opposed to just taking it by mouth. It's better absorbed if you do it from a natural route. Vitamin B12, vitamin D is also good. Now, I'm a big promoter of vitamin D, specifically because vitamin D has been implicated in women who have an increased risk of having a preterm delivery. Vitamin D deficiency is very common among people of color, simply because we don't make as much. Our skins does not allow us to make the high level of vitamin D that people who are non-melanated make. So a lot of us are vitamin D deficient. Our skin makes vitamin D when it's exposed to sunlight. So one of the things that I usually like to tell my patients is spend as much time outside as possible, but in addition, it's very good to have vitamin D supplementation.
Okay. So this also helps with fertility rates as well, because it seems like infertility amongst black women, it seems like that's rising. I may be wrong on that, but people who are trying to get pregnant, it seems like it's harder, or am I wrong?
I think the rate of infertility is increasing, and from my own perspective, I think there's an environmental component related to that. The air pollution, the foods that we eat, the plastics that we keep our food in, some of these things interfere with our hormonal levels and thus impact our fertility rates.
Oh, wow. Okay. So as far as when patients come to see you, what's one or two things that you wish they knew before coming to see you?
Bring your medications, okay? Because telling your doctor, I take the little blue pill, that doesn't help us out a lot. There are hundreds of little blue pills. So it's helpful to either bring your medications yourself in hand or write them down when you come to us. The other thing that I would really advise, particularly our pregnant patients, tell me about your past medical history. Remember things that might directly impact this pregnancy. For instance, if you've had a postpartum hemorrhage with your last pregnancy, that's important to let me know so I can keep a lookout for it with this pregnancy. If you've had preeclampsia in the past, that's important to let me know because I can give you medications to hopefully prevent you from having that again. Preeclampsia is a disease that impacts not only your pregnancy and your baby, but also in your latter stages of life because it impacts your heart health. So it's important for a woman when she's coming to see me to have all of her medical history and her medications in hand.
Okay. Yeah, I believe Judge Hatchett's daughter or daughter-in-law, I believe, died from complications with preeclampsia.
So can I just put a little hopeless plug here?
Yeah, you definitely.
Okay. There's a documentary that I'm in that's coming out probably in the next 3 or 4 weeks called Under Pressure. And it's a documentary highlighting preeclampsia and the impact that it does have on women's health and the health of their baby. So look out for that.
Okay, okay. We've got some questions from our Facebook audience.
Yes. Farah would like to know what can she do to increase her infertility. She has high blood pressure and is taking meds for that, but also taking B12 1000s and D 5000.
I think if you're under the care of the doctor and getting that blood pressure normalized, it is a good thing. One thing that I would recommend is to have your vitamin D level checked
Okay.
to see if what you're taking as far as your vitamin D is concerned is adequate.
Okay. Any questions? Okay. I've got a 4-year-old now. Ooh, she's 4. Yeah. But then I do remember back when my wife was pregnant, and we were talking about fibroids, and those being big issues.
Big issue in the Black community.
With pregnancy.
Absolutely.
Yeah. Can you speak on that, and specifically, where are they coming from, and how do we stop them?
Okay, fibroids are basically benign muscular tumors of the uterus, and for whatever reason, they are predominant among women of color. They can cause a whole host of problems. When you're not pregnant, they can grow and obstruct your bladder and your rectum by causing, urinary retention as well as problems with defecation. They can cause, depending on where they are, heavy menstrual bleeding and anemia. In pregnancy, they can become very problematic in a number of ways. One, they can grow large enough to impact the normal growth of your baby. Two, they can at times outgrow their blood supply. And when they do that, the center of them begins to degenerate or liquefy. It basically rots. And it sends out chemicals within your body which cause, you to sense a lot of pain from these fibroids. And the third thing is, depending on where they are, they can obstruct the normal labor process. If they are in the lower aspect of your uterus, they can impair the baby coming out naturally, and you have to end up with a C-section. So they are a big problem.
Yeah. So is there anything, we've heard host of different things that may or may not work to shrink fibroids or destroy fibroids. So what can we do?
Well, during pregnancy, pretty much nothing. But once you have delivered, after a few months have passed, or even if you're, prior to pregnancy, depending on where they are, you might need to speak to your doctor about removing them. And there are several ways that you can have them removed depending on where they are. And they can also impair fertility.
Okay, got it. Well, man, I've learned a lot, but where can people find you online?
Okay, online you can find me on Facebook. I'm on Facebook. I have a website, www.KeciaGaither.com, and my name is spelled KeciaGaither. I also have a Twitter handle, which is Kecia Gaither MD.
Okay. Thank you so much, Dr. Gaither.
Thank you for having me.
Yes.